Hi, welcome to my channel. My name is Dr. Israel. I'm a family physician practicing in Ontario, Canada, and I'm here to walk you through how you can start practicing as a doctor in Canada if you are an IMG. So if you're an international medical graduate, I will be walking you through how you can, the steps that you're going to be taking to actually start the journey to practice in Canada. The first thing will be for you to check that your medical school is recognized. So the way to do that is for you to check the World Directory of Medical Schools and to be sure that your medical school is listed there and that there is a sponsor's note that determines that sort of states clearly that Canada recognizes the medical school and you'll be eligible for licensing in Canada. The second step will be for you to open a physician's apply account. This is your account on the medium of communication between yourself and the Medical Council of Canada. So this is where you're going to be uploading your document, and you're going to be doing what they call source verification, where they're going to be verifying your medical degrees, your housemanship or internship certificate, your license from previous jurisdictions or other jurisdictions. So it's important that you open this account as soon as possible. The cost of opening this account is about 322 Canadian. So you should be aware of the cost. And as soon as you've opened the account, you go on to start the source verification process. Again, you have to upload your identity document, then your medical degree, where this is now sent out for verification. I think the cost of verifying each document is 232 Canadian dollars, and the source verification, depending on how soon you start, it could range between 6 to 12 months. So the earlier you start, the better. The third step will be for you to start preparing for the exams. So the MCCQE1 exam. It is a multiple choice question with clinical decision making exam, and the cost of this exam is about 1,860 Canadian dollars, and a preparation is between 3 to 6 months. So it's quite intensive, and you should be ready before attempting this exam really. The next step, this next step depends on what your journey in Canada will look like. Take for instance, if you want to go into a residency program, then you're going to be looking at doing the NAC OSCE examination. This again is an OSCE exam, 12 stations, and they will be testing your clinical skills. But if you want to sort of go through the practice readiness route, in which case you're not going to be needing the NAC OSCE, so you will have to apply for the readiness practice readiness assessment, and this varies from province to province. Each province and territories have their own assessment pathway, so you need to sort of check with the various provinces and territories to determine your eligibility for this pathway. So, and the other aspect is if you are a family doctor from any of this jurisdiction, the UK, the US, Australia, and Ireland, you will be eligible for license without any further examination for as long as you have your CCFP. So that's something to bear in mind. So if you're a doctor, you're a family physician from the UK, you're from United States, Australia, and Ireland, Republic of Ireland, then you will be eligible to get licensed as a family doctor here in Ontario, Canada, and just like in other provinces as well. So depending on your pathway, so you determine which one you want to go for. Either you're going for OSCE, if NAC OSCE, if you're looking at the residency program, or you look at practice readiness assessment. If you've got the experience, so you've worked previously as a doctor in your home country, you've had the a full license or independent practice license from where you're currently practicing, and there is also currency of practice, meaning that there's not been any break or gap in your clinical practice history. So that may be one option that you want to look into. But if you're a doctor or a family doctor, you've already completed residency in the UK, in Australia, in the United Kingdom, or the Republic of Ireland, then you would be looking at getting your CCFP certificate, and you can use that to apply without any further examination. And the next thing would be for you to look at test of English. So they want to test your English proficiency, just to be sure that you are able to communicate in English and you're able to give patient care using English language. So you also want to consider writing either IELTS or CELP. So those are the two options. And once you've had all of this, you've had this all exams done, so the next thing will be for you to start looking at applying to each of the provinces. They've got their medical regulatory authorities, and you will submit your application, and they will sort of walk you through what you need to do to obtain a license. But we'll go into that in some other videos. I just want to give an overview of what is obtainable in terms of that journey, and subsequent videos I will walk you through the step-by-step process that you need to take to get licensed in Canada. I'll see you in the next one. Bye.